of us who, spent much of our life as reference librarians, and I count myself as one of those people, this is a little hard to swallow. However, I think that it's really important for us to realize, and actually the theme of next year's MLA meeting is changing your game. This is going to be a baseball analogy, and this year was rethink. And I think we truly are in a state of rethink, and we are changing our game. And what we're realizing is that so much of what's provided by the library is used without ever people coming to the library or actually consulting a librarian or a library staff member. But that's not necessarily a bad thing. What it does say that the systems that we provide access to, we got to make them better and better and better, and that's what Scott Pluchak was saying at MLA too. It's going to be the age of systems. It's going to be the age of finally developing things that really can do better at getting this crucial information to people. So I don't think we should be discouraged by this result. I think we should say this is the world we're living in, and we have so many important roles within that new world. So I promised I would share some information about the participating sites in the full study, 56 altogether. So that Council of Teaching Hospitals, it'll be half of them from there, so they're the bigger hospitals, teaching hospitals, located in an urban area, still most of them in urban areas, but a really good spread in bed size, half under 500 beds, half over. And there's quite a bit of geographic distribution. We did make it available first in the Middle Atlantic region, so the largest number are from there. And then we advertised it extensively through the National Network of Libraries of Medicine when we decided to go national. And also Miriam Tickle, who's here today, facilitated access for the Canadian libraries. And there were many more Canadian libraries who wanted to participate, but there were actually 4 that did. And if we have time in the question period, I'd be glad to talk about some of the issues around people participating. But I think we got a lot of data, as you will see. So the 4 participating Canadian sites, the Health Sciences Library, Hotel Dieu, Grace Hospital in Windsor, the Health Sciences Library and Archives in Regina, Capel Health Regent, my mother was from Fort Capel, and the Health Sciences Library, London Health Sciences Centre in London, Ontario, the Neil John Maclean Health Sciences Library, University of Manitoba Health Sciences Libraries. So the overall response rates for the Canadian sites was 11%. They did vary, but there's a lot of stuff there. I mean, I'm just sort of trying to mentally add this up, but there's well over 1,500 critical incidents in the Canadian data alone. And you have a total of 92 health professionals who offered to be interviewed in Canada. So there is a study waiting to be done of the Canadian data, and I'm hoping that I talked to a colleague at McGill, and I'm hoping that she may be interested in pursuing that possibility, because we can separate out the Canadian data, and of course each of those Canadian libraries will have their own report back for their own institution. So, and even if you have a relatively small number of respondents, I still think you can point to the aggregate. If you're one of the participating libraries, they will still be able to point to the aggregate study results, because they were, and we may be able to eventually kind of partial out different aggregate groups. That is, the aggregate is all of those hospitals put together, right? But if we could do certain types, and actually NNLM has indicated that they may be willing to give us some more funding to do more analysis of the data. So in the full launch, in the additional 49 hospitals, so 7 pilot where you saw the 3,200 responses, and then the full launch generated 15,563 responses. Again, a 13% response rate. The response rates varied by institution. So if you add up the total number of critical incidents or respondents for the pilot and full launch, that's 18,776, and that's one whole lot of critical incidents. Okay, so I'd like to sort of just conclude, right? Susan's given me the 3-minute line. But this is the study acknowledgement statement. So any of the the participating sites that use their own data part of this is required for any federal grant, but it really does acknowledge the many people who are behind this. I only stand up here representing them and their wonderful work, and also the wonderful work that you do. I want, on the plane on the way out, I sort of opened up my Route magazine, and there was this ad for this gorgeous looking car called an Infiniti. And this is what it said on the other side. It's sort of like a value statement for this Infiniti car. I'd love to have one. It said, when machines start driving machines, we will consider changing. Computers can measure performance, but they can't feel. They can't appreciate the connection between the driver and the road. They can't appreciate the connection between the user and the information, which is why Infiniti has a master driver whose extraordinary skill is actually formally recognized by the government of Japan. His sole job is to provide engineers with human feedback, emotional feedback, which goes a long way towards explaining the efficient performance of the new 2.5-liter V6 powered librarian. I just think that we will always bring that human touch to. We recognize the importance of coming up with these sorts of studies, but our role will also always be critically important, just as it is critically important in turning out the best car that can be manufactured. And we just need to hire some really big, expensive marketing people to come up with something like this for us and have it in the front of En Route magazine. So thank you so much. It's been just such a pleasure to share this with you, and I just honor the work that all of you do, that this study only reveals. Thank you.
Thank you so much, Joanne. Are there any questions for Joanne? I'm sure there are lots. I certainly have some. At the back, Rebecca? Or, I'm sorry, Lindsay? We have someone running with the mic, so.
Hi, Joanne. Lindsay Glynn from Memorial University in Newfoundland. Congratulations to you and your team on such a well thought out and beautifully designed study. I think that these results are going to be really interesting to play with over the next little while. It's very impressive. I wonder if you can talk a little bit about the population that we're unable to tap into. So of course the people who respond to these types of data collection are those who are interested in libraries and who value the libraries. But I'm interested in those that don't respond and wonder if maybe a lack of value, and I hate to say that, but I wonder if maybe their subjective lack of value might also translate into increased expenditures or negative patient outcomes, anything like that. So I wonder if maybe you could share your thoughts on that side of the fence that we have so much trouble reaching.
Well, you can tell Lindsay is one of the Canadian leaders in evidence-based practice, can't you? Because she just asked a really good research question here. That's a very good question. What about the non-respondents? And there's a trend now in research to do non-respondent studies in this other area that I've been working for the last few years, which is workforce issues in library and information science. We did this big survey of all of the graduates of library and information science programs, because we really don't know what happens to people after they graduate from our programs, and they don't keep track of people in our field like they do in the health professions, for instance. And we did a non-response study, and of course we didn't have the funding to do that. But I think if we just use our own experience and think about, there are many things that we value that we use, and we get so many little surveys about these all the time. These web-based surveys are popping up all the time. Do we respond to everyone, even though we might value that product? And I think that we are dealing with a group of professionals here who are over-surveyed, that they did not receive a big incentive from a drug company or the Canadian Health Libraries Association or the Medical Library Association to do this, or the National Library of Medicine. There were no incentives involved. And I talked to my daughter about this, who I am so proud of. She also kind of went the research route, and she's actually now an assistant professor in the family medicine department at Dalhousie University. And I said, Emily, I got a 13% response rate. How about this? And she said, do you know how hard it is to get responses from physicians and residents and nurses? She said, I'm just amazed that you got that response rate. She said, and the other thing, she said, I think we should do a research memo for publication together. I mean, she's really got to think about doing this, right? She said at the beginning of her career. But Mama, I really think we should do this because these web surveys are a whole new genre of research. She said, if you get a 10% response rate with a web-based survey, like, you're a star. And so I just had to laugh. This is my daughter. If you could, I hope you have a chance to meet her some day. She's quite a character. But she said that's very good. And so she's actually arranged for me when I go to visit her on holiday. My husband and I will go there to visit her in August, and she's arranged for me to give a research seminar to the Department of Family Medicine, and they will invite the librarians from Dell as well, so that'll be great. But so I'll see what the physicians say about this. But I mean, if we had all the money in the world, I would say, yeah, let's do a non-response, draw a random sample of the non-respondents, and although we don't really know who responded to this because it was anonymous, unless they chose to identify themselves for purposes of interview. But it would be great to do that, but we can't. So, every research piece has limitations. That's certainly one of these. And I think another study that just looked at library non-users would be a really important study to do. And I wish this study we could have done that. But all I can say is if you read the stuff on critical incident, they're not so concerned with response rate. Although, again, you could say, well, the people who responded are different from the people who didn't respond. But this is what we got right now. So, and if you look in the literature, I mean, this is a pretty good response rate for a web-based survey. Thanks for the question.
Anyone else at the very back? Please make sure you introduce yourself and where you're from. And it's Jennifer. Hi, Jennifer.
Hi, Susan. Jennifer Bain from the Canadian Virtual Health Library. And Joanne, thank you for acknowledging it. Joanne and I have known each other many, many years, and I wanted to tell you, Joanne, and just acknowledge you in the room, that when we were putting together the proposal for the Canadian Institutes of Health Research that funded the CVHL, we used your study, your Rochester study at that time, and actually extrapolated from your results and quantified it again, using some of the key indicators, and used CHLA data and looked at, for example, patient mortality rates and then extrapolated to dollars. It gets complicated. But the impact in Canadian dollar terms was absolutely humongous. I mean, millions and millions of dollars. So I would imagine on a local level, it would be equally impactful. But anyway, Ian Graham, who is the Vice President of Knowledge Translation, well, he did explicitly say that he was incredibly impressed and wanted to know more about the Rochester study. And he said, I like to think, to be honest, that that's a good part of the reason why we got the funding that we did. And he said, I would like that study replicated. He said, is there any way we can replicate this? And this is before I knew about this study that you were doing. So whatever you want to do in Canada, if you would like me to participate or like me to facilitate, because he said, he was adamant, he said, I would really like to free up some money to replicate this study again.
Wow.
So, yeah, and we've spoken a number of times, but he was really impressed, and it was that value proposition, I'm convinced. I don't know if Patrick and Jim and Susan and others feel that way, but it was I'm sure a big reason for our funding. So.
Wow, that's so wonderful to hear. I mean, this, as you can imagine, being a Canadian in the U.S., I'm always looking for ways to get Canadians into things, and at a certain point, we start to realize that it's very challenging for the librarians here. They had to find a study champion. They had to get access to these listservs. They really had to do a lot of legwork to get this study going in their institution, and going through the ethics review is another story. But I think there's real potential, and if more people are interested in doing that, and if there's funding available, the methodology is right there, and it would be so delightful to work with you to replicate it on a larger scale in Canada. And you've done your pilot. You've got 4 sites that have participated already. So, there's so much potential. And we're going to, this is just the beginning, just like it's the beginning of the digital age, really. It's the beginning of the age of these value studies, and there will be many more ways to look at this question. It will be the question